The difference between abortion and pregnancy-related care is like saying heat wave and weather. Abortion or termination of pregnancy is part of obstetrics and gynecology, and as such, it is part of reproductive health care for women. We're hearing about a type of pregnancy known as an ectopic pregnancy. This is an uncommon pregnancy complication in which the fertilized egg will implant outside of the uterine cavity, most often in a fallopian tube. This is a life-threatening situation for the woman. It cannot, under any circumstances, continue because as the pregnancy grows, the fallopian tube will rupture, causing a potentially catastrophic hemorrhage. It requires specialized care and treatment and follow-up. It requires blood tests, it requires ultrasounds, oftentimes will require surgery. If a woman had an ectopic pregnancy and was not treated at all, she would die. There are some risk factors that we know that are associated with an ectopic pregnancy, but many ectopic pregnancies occur in women without any previously identifiable risk factors. They happen out of the blue and they require specialized OB-GYN care. In the case of a septic abortion or septic uterus, basically the uterine cavity becomes massively infected. That infection then spreads into a woman's bloodstream and causes a condition of sepsis, and then if untreated, septic shock, and that can be fatal. The treatment for a septic uterus or a septic abortion is suction D&C, or evacuation of the uterine contents, and antibiotics. There's also a certain type of miscarriage or first trimester pregnancy loss, potentially second trimester pregnancy loss, in which the woman's cervix will start to dilate, the woman will start to hemorrhage, there may or may not still be a heartbeat, and the treatment for that is emergency surgery. If a surgical procedure is not performed, the woman will hemorrhage and die. I want to be crystal clear, that happens all the time in women's health. Certain types of miscarriage, the heartbeat will continue, the woman's cervix will dilate, she will start to hemorrhage, and the treatment for that is emergency surgery with a D&C.